Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Network Strategist with the Division of Public Health and Community Services. And before we get started with our guest, I just want to give you a brief COVID update. You'll see on our map, which shows 2 weeks ago and this week, that we are holding relatively steady, especially in New England. We're at green in New Hampshire. The whole state has low transmission levels, and that's based on hospitalizations. That's not to say hospitalizations have not been rising. They have been in New Hampshire. Currently, there are a little over 100 hospitalizations for COVID-19 and about 20 people receiving treatment for COVID-19 of those 100. If you look at the next slide, you can see New Hampshire a little bit better, and you'll see again that we are completely green in New Hampshire and holding steady. If you are moving indoors, we're dealing with the BA4 and BA5 variant and very highly contagious. So please wear a mask and make good decisions if you're going to be inside. If you're attending a party, hey, open those windows because this is a very contagious variant, again, of the COVID-19 virus. And just a reminder that it's not too late to vaccinate. You can still get your COVID-19 vaccine, and you can start your series today, and you are just not too late to get that protection. So I'm delighted to welcome our first guest, who is Mary Ann Melizzi-Golja. I knew I'm going to say it, Golja. Perfect. I did it. And we're going to talk about back to school.
Yes.
Here we are in August, but it's time to get ready for school, and we've got lots of things coming up. And it's exciting because we're going to be opening school for real, and I don't think kids will be wearing masks, and hopefully getting back to a new normal. Right. So you have been planning this event for a long time. So first, just tell me how you came to plan this event 19 years ago, as we were discussing.
Yes. So 19 years ago, I was a new member of the Board of Ed and a new member of a committee in Nashua that was looking at how to reduce the dropout rate. Mm-hmm. And it was just prior to the opening of the two schools. So one of the pieces they were looking at was relationships with families and relationships with students and between students and staff in buildings. And the committee, the big committee dissolved, but out of that committee, the family relationships group decided they wanted to do something. Mm-hmm. So a group of us met. Mayor Streeter was the mayor at the time, and Joe Giuliano was our superintendent, and they said, yes, we'll support you to do something. The chamber came on board and said, we will support you in getting funds from the business community to do this event. And the rest is history. And so at that time, Chris Hodgson was president of the chamber, and he introduced me to George Cadis, who I know many people in town.
I do know George.
Yes, Nashua Paint and Paper and Ace Hardware now. And George has always been a supporter of families and students in education. And so he basically became the lead in working with the chamber and the business community to fund the event. And I, along with Latha Manjapudi at the time and a number of other people with some of the youth serving agencies, worked with the chamber to purchase items and put the event together. And we have been very lucky in continuing to have support from the chamber as well as the school district. It is on every principal's calendar, and the expectation is that they will show up.
So it's a time for students to come, of course. So let's start with it's August 25th this year.
Correct.
And it's at the library, in the Public Library Plaza.
Right.
And it's from 5 to 6:30. So we'll get those, after this, they'll see the sign. We have it in English and Spanish, so we hope that we can really get all families to attend with their kids. I was fortunate to attend last year.
Oh, great.
With Public Health. And so you said all the principals will be there. So what's the importance of the principals being there?
So, as I said, back in 2003, 2004, the research was showing educators that students and families needed to feel connected to the staff in schools and to the community. And lo and behold, moving forward, almost 20 years, the research is telling us the same thing. And so we're really about having students and families come and meet the principals in a neutral spot, in a festive environment. And so really having that back to school greeting occur in a place where everyone feels good. And for us, it's been very interesting because we've been doing this since 2004. So we actually have seniors in high school who have been doing this since they were in kindergarten. And it's just part of their routine for going back to school. And a couple of years ago, I had a group of 8th graders come in, and they were like, "Where's Fairgrounds? Where's Fairgrounds?" And I was like, "Oh, they're right over there." And they came alone, and they were all about going to see the principal and whoever else was there from the building. So that says to us that something's working if kids are coming on their own when they're able to do that because they want to come and have that greeting. So that's the real important piece about having the principals there and just giving them that opportunity to see a parent who maybe they saw in their office 4 times last year, start the year out fresh and in a fun situation.
Yeah, I always like back to school because to me it's like a fresh start.
Yes.
You know, everyone can start over.
Right.
You know, no matter what kind of year, like you said, the last year you had to be in the principal's office 4 times. But now let's start over and just give that, not necessarily start over, but give that fresh start.
Right.
And now, do the principals come in their ties, or do they come in summer wear?
They come pretty casual, like
so approachable.
Yeah.
So
And some of the athletic coaches come, and guidance counselors. Sometimes you have a PTO rep there, but everyone's pretty casual and just ready to give hugs and greet people.
Yeah, that's great. And so every school is there. And every school in the district, and there are a lot.
Yeah, 18.
18 schools, so you have at least 18 tables.
Yes.
For each school.
1 for each school, correct.
Okay. But there's more than 18 tables, because I was there.
Yes,
So what else, what other kind of organizations are there?
So this year, like last year, everything's outside, but as part of our health piece, to prepping for going back to school. The health department will be there with their van.
Yes.
They'll be handing out information, and although in the past they've done vaccinations, this year they will be just making appointments for the clinic. But you can go and make your appointment and get that taken care of. And then the only piece we have inside the library is the Lions Club.
Okay.
And they will be doing vision screenings.
Oh, nice.
And it's all for free. You go in the front door of the library, and they're set up, and they will do the vision screening for you.
Oh, that's fabulous, because that's so important. To start the year off the right way, make sure you don't need corrective lenses or, or need to sit closer to that. I was going to say blackboard, but I don't think they have blackboards anymore.
Smartboard, yeah. Well, and the other piece is with the new vision screening equipment that the Lions have, they're able to screen younger children, so we can look at toddlers and preschoolers and really do some early identification, which is so important for all those pre-reading things that are going on. Yeah,
that's great.
And then out on the lawn, right now we have 28 different agencies that provide services for families and students.
That's critical, like to get families linked to those services. that they may need, whether it's after-school services, counseling services. I would imagine if you're working with the chamber, you may have some extracurricular organizations that are maybe selling a little bit. Not, you know what I mean, trying to sign up, or
and
is there a limit?
They're marketing, but there's nothing for sale.
Yeah,
which is also,
selling,
right.
marketing is the better word.
But I think it's important for parents to know, because going back to school is so expensive, but you can come and have fun, get a few more school supplies, have a snow cone, listen to the DJ, and find out about a music program or the Boys and Girls Club, and not have to pay for anything, which I think is really important.
Yes, and I do agree. Like, marketing is a better word than selling. I meant, like, you know, advertising what they have, what they have to offer. So what kind of school supplies can they come and get?
The school supplies we have available are bags with basics, crayons, colored pencils, a notebook. We order prepackaged pencil packs that have pens and pencils and erasers and a pencil sharpener, glue sticks, one of those folders everyone needs with the take it home or take it to school, leave it at home. Everyone needs a two-pocket folder, so you'll get one of those. And those are the supplies we provide in drawstring goodie bags that you get when you meet your principal. And then out on the plaza, all of the organizations are providing school supplies.
Right, right. And I know also at the health department will supply things like hand sanitizer or whatever kind of goes along with the theme. Last year I worked it, and we had a lot of stuff around lead testing for some families, and the kids just loved it. They loved getting the giveaways, and they liked seeing what you had to offer. And I think it's great. It takes a little pressure off of parents too on some of those supplies, because like you said, getting ready for school can be very expensive.
Yes, yes.
And I'll just give a shout out to the Nashua Soup Kitchen, who also has a backpack program. So if parents are looking for some additional assistance, they can get a full backpack there. Just want to remind, you know, it takes a village to get the village ready for school. So I don't want to not mention them. And this is good for parents as well. So what's the benefit for a parent?
Well, it's very interesting initially to see just parents greeting each other, because some of them haven't seen each other all summer. So it's like, oh, how was your summer? What'd you do? And then for parents, it really is a one-stop shop. If their child's talking about signing up for bitty basketball for Park Rec is there. You can get the information. And for parents who are new to the community, it's an opportunity to really see what's there without relying on the internet or hoping someone you knows what a resource is. So I've had parents say to me, this is great. I didn't know this agency was here and my child could get music lessons or art lessons. So I think it's a short time, 5 to 6:30, but I think parents are able to get the information they need and make the connections and feel like maybe they're a little better prepared for moving forward with the school year.
Especially those that are new to the district too.
Yeah.
And what a great thing to have that and have all those resources available all in one spot, like one-stop shopping, like you said. And I can imagine when you're first starting in a school district and you know, and maybe put your kids at ease as well. If they're meeting the principal, the big scary principal.
Yes.
Not that they're big and scary, sorry to all the principals out there, but I can remember as a kid thinking, wow, you know, the principal, that was like a big deal. So I think that's nice to bring that down and have that communication and that meeting. Any other things you want to tell us about the event?
One thing that has changed is that we used to be in the library with the principals, and now we're outside. So the event, the entrance of the event is actually off of Cottage Avenue,
Okay.
coming into like the library parking lot. So families will come in that way and find their school and their principal, and then come into Library Plaza and enjoy everything else that's there. I just found out that the Federation of Teachers, AFT, is going to have a bus, their bookmobile there, so students will be able to get a book, which
that's
is always a
great.
good way to start the year. And of course, our public libraries there to give out library cards. So
Oh,
that's
that's
one of the
nice.
things you'll be able to do. And then I'm going to give a plug for the school department, and specifically for free and reduced lunches. I think, with lunches and breakfasts being free, people have kind of forgotten the importance of signing up for that to determine eligibility. But we'll have the food service staff there and applications to do either online or hard copy. And completing that is really important because the numbers that we collect in the percentage of families eligible for free and reduced lunches also is used to not only compute whether your child gets a free or reduced price on their lunch, but it's used to compute staffing in school, resources in school, and other organizations in the city use those numbers for their grants to
And I think the
justify
federal
services.
government uses
Yes,
those statistics as well.
right.
So in the past, because of COVID, I know that I'm assuming that's what you're referring to. It was
Right.
free breakfast and lunch.
Correct.
But that is going away.
Right.
So
So
that
we've
is really,
heard.
yeah, well, I believe it.
Yeah.
And so that is a really critical thing. So
Right.
if a parent needs to fill that out, is there something they should bring with them just so that they're prepared?
I have not been told they need to bring anything.
Okay.
And I'd asked that question before, and they said, no, we'll be there with the forms. And
Okay. So it'd be
So-
great if they had some assistance.
right,
Because some of these forms, there's forms for everything, and just
Right.
to any assistance we can give people
right,
is really great. It
Yeah.
really bolsters the whole community.
Right.
So this is an amazing event because I feel like you've thought of everything.
we try.
You've got
It's
the
not just
lunch.
me, it's
Yeah.
my team. It's
But
the-
I'm sure it's grown over the years,
Yes.
but it's really a community event. Having the chamber involved, local businesses, whatever they offer involved, the health department, of course, and of course the schools. That's just really, it strengthens our community. So
Right.
I thank you for putting this on every year
well, and
with your team.
I just want to say the city, it really is the city and the chamber and the Telegraph supporting us also in getting the word out. But the city basically says to us, whatever you need, we'll do it for you, which is unheard of in most places. So Park Rec is there, the health department's there, the library's there, the schools are there, public health. The police department helps us with crowd control, traffic management, and the mayor's office, whatever else we need is available to us. So it's a ad hoc committee of volunteers that comes together usually before the school year is over to start planning going back to school, and is really well supported by the business community as well as the city.
Well, thank you, and thank you for all you do and holding it together.
With everyone, yes.
With everyone, of
Yeah.
course. It's definitely a community effort, but you've been spearheading this for a long time, and it's really just a great thing. So I hope people remember August 25th
Yes.
from 5 to 6:30, and you'll be getting a goodie bag to collect all your stuff in, so don't bring an extra bag.
Right.
We've got the bags. You've got the bags
We've
for them.
got the bags.
School supplies, all of those things. We hope you have a great turnout this year.
Thank
Hope
you.
it does not rain or it's not too hot. So we'll start putting those requests into the weather people right now.
Exactly. We're already thinking about that.
So, well, thank you, Mary Ann.
Well, thank you.
And thank you. We'll be right back with our next guest.
I'm a doctor, but I can't think clearly anymore, so I can't do my job.
Long COVID causes debilitating cognitive issues.
I'm a runner, but now I can't walk 100 feet without getting exhausted.
Long COVID causes crippling fatigue that may last a lifetime.
I've lost friendships because of long COVID. I just don't feel well enough to see people.
People may look outwardly healthy, but they're suffering from a physical disorder that can upend lives.
Everything hurts. I can't even go out and play.
Up to 30% of COVID patients develop long COVID, and right now, there's no cure and little understanding.
I can't focus, I can't think straight, I can't keep a job.
So for those suffering daily, there's just one urgent question.
How long?
How long?
How long?
How long?
Until we solve long COVID. The Solve Long COVID initiative is bringing together patients, researchers, doctors, and drug developers to find answers now. To learn more and see how you can help, go to solvelongcovid.org.
Welcome back to Public Health Matters. I'm pleased to welcome my next guest, Sasha Potska, Public Health Nurse with the Division of Public Health and Community Services. Welcome, Sasha.
Thank you very much.
I'm so glad you could be here today to talk to us about a lot of things. It started off just about immunizations, but we're going to back up a little bit because when we have someone with knowledge, we're going to talk about some other things as well. So we're going to start with monkeypox. Okay. We already talked a little bit. I gave a little update at the top of the hour about COVID-19, but we can circle back to that. Right now, we're really spending a lot of time at the division talking about monkeypox, and it's on the news and everything else. So if you want to give us a brief update on the numbers in monkeypox, that would be really helpful just to put it into context for our audience.
Okay, so we have we have 31,800 total cases worldwide right now, and of those, it's 31,425 are in non-endemic countries, and that means they're coming up in countries where they don't usually see it.
Okay.
So there are some countries in Africa where they have seen there's a history of the monkeypox virus, but we're seeing it worldwide now in almost every country.
And an interesting thing I heard was that in the endemic countries, they have very few cases compared to this.
Right. Yeah.
So maybe have they been getting the vaccine in those countries, or just dealing with it better than we have?
I think part of it is the mode of transmission in the rest of the world right now is a little different. In Africa, you tend to see it more in families.
Okay.
Because one person gets it and they transmit it to their families.
Okay.
And they usually get it from animals, rodents like rats, prairie dogs, different animals can transmit it to them.
All right. So I cut you off, so keep going with your numbers.
In the U.S., we have the highest caseload. We have 10,392 cases. And in New Hampshire, we're a low burden state right now with 15 cases. Although our neighboring Massachusetts does have 174, and New York has the highest number of cases in the U.S. with 2,132.
And I also did hear that out in Los Angeles or California, they have a little under 2,000 cases as well.
Yes.
Heard that in this morning's report. So let's talk a little bit. I do have a picture of what people should be looking for or noticing, not to ignore, in other words. So we'll pop that up there and people can kind of look at that while we talk a little bit more about what are the symptoms.
So a rash is a typical symptom, and it's a similar rash to if you ever had chicken pox when you were a child. So
I did.
Mostly people over 50 will have had it when they were.
Oh, great! Yeah. Now everyone knows how old I am.
Or I don't know when they started vaccinating, but it was much
It's
not when we were children.
Yeah,
that's for
none
sure.
of my. I mean, the thing is, those of us who remember chickenpox, who had it, none of my kids have had chickenpox, and I'm actually really grateful for that because it wasn't really that much fun. I got it kind of when I was 14, which was really late. And, it's not the best.
Right.
So anyway, I interrupted again.
Typically, it'll be a smaller outbreak in a specific area, typically where you're exposed, but it can be everywhere as well. So it usually looks like little pimples or sometimes like a small blister. And it can be painful or itchy. And then it goes through several stages, and it'll crust over, and then that crust will fall off. And when you have new skin growing, that's when you know you're not contagious anymore.
Okay.
You
And
can
how
al-
long does that take right now? Are we
It can
hearing?
take about 2 to 4 weeks.
Okay, so that's a good amount of
Yeah.
time to like not be contagious anymore.
Yeah.
So you're kind of staying home, and that's a well, and that I think that's an important point to bring up with people because if you are diagnosed with this or you are a positive for monkeypox, you can't go to work. You can't go to. You have to like.
You have
You're
to
back to this
isolate.
whole isolation thing that we're all familiar with from COVID, but this is significant. You know,
Yes.
2 to 4 weeks is quite a long time. So it's very important for people to understand why this is urgent, why we want people, and it can be painful. And if you have other exposure, if people are exposed, you know, we just want to nip this in the bud if we can. I saw some other symptoms too besides the rash
Yeah,
are
so you
kind
can
of
have
typical.
fever, chills, swollen lymph nodes, fatigue, so you can feel really tired, muscle aches and back aches, headache, and then some people have respiratory symptoms, so they could get a sore throat, nasal congestion, or a cough. And for some people, the rash starts first, and for other people, the physical, like ailment, the flu-like symptoms start first. So it really varies. And some people only get the rash and no flu-like symptoms, so it presents a little different in everybody.
So in order to spread monkeypox, it has to be close contact. So we want to reiterate that. It's this close contact, and it's that really that pock itself that is spreading the contagion. I don't know how, you probably have a better term than I do.
So it's skin-to-skin contact with a lesion, of course, is the most infectious way to get it. You know, but you can also get it from respiratory droplets. So just like coughing, sneezing, but it does require, like for us sitting maybe even a little close next to each other, I'd have to be next to you for about 3 hours to, you know, be considered a high-risk exposure.
Okay, so it's
This far
really
apart-
prolonged contact
Yes.
in those situations.
Correct.
And then if any of the fluids are on anything, and there's some contact with
Right.
that.
If you have any contact with the bedding, or if if somebody's always sitting on the same chair in the living room and you sit on that chair in the living room and they have scabs or like, exudate from the lesions, anything from the lesions is on there, you could get that as well. You could get it that way as well.
So right now what we're doing is, there is, it changes daily as of yesterday, but it changed till yesterday even, but we were looking for those that were exposed, that were high risk, had a high risk exposure. So that was either that close contact or even a household contact, as you were just explaining. If you're sitting and sharing a bathroom and all of those things in a household, and someone has monkeypox in your household, those folks were eligible for the Jynneos vaccine.
Correct.
So, and then today,
So today they announced that we are going to start with preventative vaccination. So it's called PrEP, or pre-exposure vaccination. And so that's primarily for people who are high risk for contracting monkeypox virus, pox virus, and aren't necessarily immediately exposed.
so I was reading there was a list. So you can, if you're on PrEP for HIV, you might qualify. If you have had more than 3 sexual partners in the last month. There was also, there was a whole list from the CDC, so I don't know if that's something that,
I haven't seen the list yet,
Yeah.
but because they just announced it at a meeting.
Yeah.
I was at it a couple hours ago. But they will be announcing locations where you can obtain the vaccine on Monday. There'll be a list on the Department of Health and Human Services website for New Hampshire.
okay.
So there'll be places where you can get it.
So it's the 15th, I think it was, they said that it would be official and
Yes, I think
more
that's
widely
Monday, so-
available. Now, if you suspect you have monkeypox or you have a lesion or something, the first thing we want to remind people is to call your doctor and to have it looked at and have it tested. So those are, and then obviously if you're calling your provider to inform them, this is what I think I have, so that they can be prepared with the appropriate PPE and
Yes.
their office as well. But it's very important that people talk to their providers.
And typically, a lot of people, get worried as soon as they get a little pimple now, they're going to be worried that they have monkeypox. But unless you have risk factors, you probably don't have it. So risk factors, right now the highest risk group are men who have sex with men, simply not because it's sexually transmitted, but because that's the population it's being spread in. Like they're having contact with each other, a lot of close contact, and they're spreading it. There are people who are not in that group getting it as well, probably through household type of contact or other types of close contact.
Right. So it's not, as like you said, it's not sexually transmitted.
Correct.
But it is that close contact. So we just want to make people aware of that as well. And then we have at the division, we'll be holding, not at the division, but we'll actually be doing it at the library. We're going to be having a monkeypox forum, and that's on August 18th. That's a ways away, but so much will change between now and then. So it's good that we're having these forums and that they're already scheduled, because really the news is just unfolding on this every day. I feel like our response, though, is we're handling this in the best fashion we can right now, hopefully.
And we're handling it, of course, better than we did COVID in the beginning, because now we have experience on how to handle an outbreak.
Right. One positive
Recent
thing about
experience, I should say,
one positive
because-
thing about COVID.
Right. Because we have some sort of pandemic or epidemic every 10 years approximately.
Right.
The last one, I think, was the swine flu, the H1N1 flu.
Right.
Which was a lot smaller, but now it's become normalized. Most flu cases now are H1N1, and we expect that every year, and we vaccinate based on that. And the same thing's happening with COVID, and I don't know, we'll see if that happens with monkeypox as well.
Right, and you and I were talking about it, how there, if you are over a certain age, you've had a smallpox vaccine, which does offer some immunity.
There have been,
they're looking at that.
Studies that show that it still may offer some immunities, but they're also saying don't count on it to be effective. So if you do have an exposure or if you're high risk, you should still get revaccinated.
Okay, so that's important to remind people. Okay, I don't want to mislead people. So aside from monkeypox, which is, obviously takes priority right now, you are the coordinator for the Sexual Health Clinic, newly named, newly renamed. And so tell us about, what services you offer there, and why we offer it at Public Health.
So we've decided to rebrand our clinic as a sexual health clinic because we're promoting health. And when you just look at STD, HIV clinic, it looks like all we're doing is treating diseases. And that's not true. We want to promote health, so we want people to come in with their partners to get tested before they have any kind of sexual encounters to make sure both of you are healthy and safe before you engage in activities. We're also starting to offer PrEP for HIV patients, to prevent HIV, so pre-exposure prophylaxis, which is a medication you can take to prevent from getting HIV. So if you're have any kind of high-risk behaviors, like you frequently have new partners and you don't know their status, or you have a partner who's HIV positive, or maybe you're an injection drug user and you frequently share needles. So these are
Which you shouldn't do.
Which you shouldn't do, correct? But if you are in the high degree, if that's one of your high-risk behaviors, you can take a medication to prevent the transmission of HIV.
And I just say that just because it's hard. Because we also have a program where we do needle exchange as well. So, just, in order to prevent that kind of transmission.
Correct.
All right. So we offer, this clinic is on Thursdays, every Thursday at 18 Mulberry Street from 3 to 6 p.m. Do you need an appointment?
Yes.
Okay. So that's 603-589-4500, and you want to press option 2.
Yes.
So for those of in need, it's a sexual wellness clinic, and there's all kinds of testing that's available. And I think, I like the way you say that. We're really looking at prevention too. Before you maybe, you've met someone new, you want to make sure you're both safe before you engage in any kind of activity. That's just so important that people are tested and know their health status. Originally, so now we've talked about 2 things, but originally we were going to talk about immunizations because it is National Immunization Awareness Month in August, and that's all immunizations, but we thought this would be a great time specifically to emphasize childhood immunizations, because kids are getting ready to go back to school, and they do have to be up to date on their vaccines in order to attend the public schools. It's really essential. So I just want to back up and talk about immunizations in general and how important they are, and how it's this amazing public health intervention that has been around for, you know, decades and decades, and how important it is, because we lost a little ground, you know, during COVID.
Absolutely. So one of the main reasons vaccines were invented was to prevent children from dying. A lot of the scientists who were working on them, especially Dr. Hilleman, there's a whole documentary about him. His goal was he didn't want children dying from diseases that could be prevented. So chicken pox, polio, or, you know, or becoming permanently scarred or disabled, like from polio. So, you know, any kind of, you know, measles, mumps, like he wanted children to not even get sick from these vaccines. He developed a variety of vaccines, and we started implementing, and we've seen a huge success. I mean, when's the last time you heard someone had polio? I mean, recently there was a case in New York, but before that, nothing for the longest time.
Right.
Smallpox, nobody gets smallpox anymore. Why? Because a vaccine was developed.
Right.
So
yeah, it is miraculous. And just to go back to the chicken pox, I mean, you know, the next generation, and I've witnessed it, and it's just amazing to me to see that my kids didn't have to have that.
Right. And the mumps, I had the mumps. I had the chicken pox.
My brothers had the mumps.
I had both of those when I was a child, and kids don't have to worry about that anymore.
Right. And they're not fun. They're not fun diseases. And, you know, there's so many that have been really almost eliminated, I would say. Pertussis is another one, whooping cough. What a horrible, horrible sickness to have. And just polio, as you mentioned. So yes, you can survive it, but you're not going to thrive necessarily afterwards, because it is really disabling. So we talk about, you know, it is, there's so many vaccine preventable diseases, and we just want to encourage people to get up to date. We have a great poster to throw up there to catch up this summer. It's a great opportunity. So we'll start with the young kids, the younger kids under 10. They're basic immunization series that kids start when they're born.
Yeah, so right when they're born, they start with hepatitis B vaccinations, and then they go into, you know, then they start getting their DTaP, which is similar to Tdap, but it's in a different order. So
I was going to say,
it's a smaller dose for the younger children, so they need more of them. It's diphtheria, pertussis, and tetanus.
Right.
And then, so they go through a series of that. Polio, they have Hib, which is for human, I can't pronounce this one very well, human.
Yes, I know what you mean.
It's a type of type B influenza. What it is, yeah. It's a very difficult word to pronounce, but so there's a whole slew of them. And there's a schedule every so many years, especially when they're younger. So first every couple months, then yearly, and then at every age there's like a different list of vaccines that are due.
Right. Until
they become teenagers, and it's like spread out a little bit more.
Yeah. So if you are bringing your child back to school and you haven't been to the doctor in a while, we just want to encourage parents to please, please, please do those catch-up vaccines. We do offer them in our office, and we'll put those hours up at the end to do some catch-up vaccination. And it's just so important that you call your doctor or call us if you need those vaccines, or if you haven't been in a while, just even to have them reviewed to make sure you're up to date. School nurses will be, I imagine they'll be calling through everybody's files soon to make sure, and they'll probably be getting in touch. So the Public Health Department on Mulberry Street is a resource for those vaccinations as well. And all we ask is that you bring your record with you.
Actually, if you can send it to us ahead of time. So when you call to make your appointment, we'll let you know what we need, and we'll give you an email. You can send it to our email. We'll review it, and we'll be ready, and we'll know what vaccines you need before you come in.
Okay. And some people might not be able to do that, to send it via email. So as long as they have their paper copy, we'll let them know.
They could drop it off as well ahead of time.
And
there's different options.
Make a copy. Yeah. So that's really important for those young kids. And then Sasha, you had asked a special ask too, to some reminders about adolescence.
Yes.
We have yet another poster to put up there about our older kids.
So since 2020 and 21, we saw a huge drop in routine visits to pediatrician offices, and so that was for vaccinations and physicals, and to check general labs and make sure kids were healthy. And the population that was most affected by this was the 10 to 19-year-olds, so our adolescent population. They are really behind on routine vaccinations and just general health checkups with their pediatricians. And of course, a lot of it in 2020 was, difficulty getting into the offices, and through most of 2021 as well. So it's just really important to make those follow-up appointments, bring your child to the doctor, or at the very minimum, bring them to us to get their vaccinations up to date so that they can, remain healthy and we can prevent those vaccine-preventable diseases.
Right, we don't want those going into the schools. And that's why we need them, because the kids are in close contact in schools. So we absolutely want to protect every single kid that comes through those doors. And I suppose for adolescents especially, like HPV is new, and the meningitis.
Meningitis, yep. And meningitis is a very deadly disease, so that's very important.
And a lot of kids are asked about that, speaking from experience, when they're like teenagers, because then when they're thinking about going off to college or being in a more congregate setting, whether it's a dorm or wherever it is in other classrooms and other universities, having that protection against meningitis.
So there's two different, there's the Menactra, which is meningitis ACWY, they get that a little younger, and then before they go to college, they get the meningitis B.
Okay.
That's the one they prevent in the dorm, that's more common in the dormitory setting.
Okay, yeah, so.
And we recently had an outbreak in Florida in a university for meningitis B as well.
Wow.
So.
So it's still there, so we want to make sure that people are vaccinated against that. And you're making me think, I think I have one scheduled for my son, actually. So just a reminder that we have immunizations on Tuesdays from 4 to 7 and Fridays from 9 to 12 at the Public Health Clinic. We have our sexual health clinic on Thursdays from 3 to 6. And we also do lead testing, and that's very essential. From 4 to 7 on Tuesdays and 9 to 12 on Fridays.
Speaking of lead testing, it is a New Hampshire law that children are tested at age 1 and age 2, because elevated lead levels can cause, the brain not to form properly, can cause a lot of behavioral and a lot of problems, a lot of developmental problems for children. So it's really important to get your young children, like babies, the 1-year-old and the 2-year-olds, get them tested. And actually any child 6 years or younger who hasn't had a lead test should also get tested. And then we offer for anyone with a blood lead level of 5 or higher, we offer case management. We go in, we try to help the parents do whatever we can to find out where is the lead coming from and provide interventions how to reduce that lead level.
And then we can also hook them into other resources in the city that do the mitigation of the lead within the homes.
Absolutely.
And we also have just so thank you. This is my kind of wrap up here, but thank you so much for telling us about immunizations and for Billy pitch-hitting, because we surprised Sasha with this guest appearance on Public Health Matters, but I do appreciate it. It's so important. Immunization and is one of our biggest tools in public health, and to keep everyone healthy. And we're focusing on kids today, but it's for adults as well. The shingles vaccine for those 50 and older, for example, it's another one that's very important. In fact, I think, Sasha, you gave me my shingles shot, so thank you.
Probably.
And here I'm really telling my age today on the show. But anyway, I just want to remind people we also have a mobile clinic, and that is also immunizations and sexual wellness on Wednesdays from 10 to 12 at the Nashua Public Library. And so if you are going to come for a vaccine, please bring that record. And sexual wellness on the 2nd and 4th Friday of the month, and that's at Layton House. And we also have sauna, which are our syringe exchange services, and that's Mondays and Wednesdays. Mondays from 10 to 12 and Wednesdays from 2 to 4. Just some other reminders. We're going to be showing our Photo Voice photo gallery. That's going to be at the Nashua Public Library on Wednesday, August 17th. And this is kids taking pictures of their own experiences. And the theme this year is who and what makes you resilient. Also a reminder that on Sundays, our own city has its own farmers market from 10 to 12 in City Hall Plaza Park. Please come and load up on those vegetables and all the good things that are being sold and made locally. And we have Brazil Fest on August 27th at Greeley Park. So if you want more information, you can call 603-438-4263 and get involved with that. And finally, one last reminder, because I'm a mom and this is what I do, get fully vaccinated, protect yourself and those you love. And with that, I thank you, Sasha, for being on our show today.
Thank you for having me.
And I hope you all have a pleasant and healthy week. And don't forget that public health matters.
Monkeypox is a rare disease that is caused by infection with monkeypox virus. Symptoms include a rash with skin lesions that appear on certain body parts or all over the body. Currently, CDC scientists are tracking multiple outbreaks of monkeypox that have been reported in several countries that don't normally report monkeypox, including the United States. Anyone can catch monkeypox if they have close contact with someone who has monkeypox. You can get the virus from touching the rash on your partner's body and then touching your eyes, nose, or mouth, from breathing in small droplets when close to a person who has monkeypox, from touching items and surfaces that have the virus on them, during intimate contact such as sex, kissing, or hugging a person who has monkeypox. If you have new or unexplained sores, rashes, or other symptoms, see your healthcare provider for medical attention and evaluation. Anyone who has been in close contact with someone who has monkeypox could potentially catch monkeypox. The overall risk to the U.S. public is low. Monkeypox is a much more difficult disease to transmit than others, such as COVID-19, and requires close physical contact to spread. Monkeypox is not something you will pick up walking by someone in the grocery store. Currently, the overall risk of monkeypox to the U.S. public is low. To protect yourself from monkeypox, avoid close contact with anyone who has monkeypox or has a rash that looks like monkeypox. People can catch monkeypox virus through skin-to-skin contact with someone who has an active rash or through respiratory droplets spread through short distances in the air. Unlike respiratory illnesses that can pass between people at a distance, monkeypox is not something you can catch by passing someone in the grocery store. Symptoms of monkeypox can include a rash or sores, sometimes called pox, and often occur after flu-like symptoms like fever, headache, muscle aches, swollen lymph nodes, chills, and exhaustion. If you have a new or unexplained rash, sores, or other symptoms of monkeypox, see a healthcare provider for medical attention and evaluation. If you do not have a general healthcare provider, visit a public health clinic near you. While you have symptoms, avoid close contact with others, including having sex or being intimate.